today is the Social Prescribing Showcase event. Social prescribing itself is about supporting health and wellbeing. So this event is really an opportunity to showcase those organisations.
So good morning, I'm Ruhal Rana. I'm the Skylight Director at Crisis. Crisis Skylight is a charity, a homeless charity for people who are going to be made homeless or sleeping rough or self-serving. We're there to support those members. We offer a lot of wide service. We provide one-to-one support. We also provide a lot of activities. We help members with any issues with housing that they might have, with benefits and so on, or universal credit. We actually also support with getting into employment as well, if they need assistance. And also we do a lot of wellbeing activities as well, including English and maths, if we need to go on to the next road. We're here today at the social prescribing event, where we've met with the charities we also work with as well. There's fantastic organisations here that we've already spoken to. Yeah, absolutely great event. It's been absolutely amazing.
I'm here with West Midlands Police Cadets, and we're engaging with the public, trying to recruit some cadet leaders, telling people about what Cadets is about and the benefits that Cadets is for young people. As cadets, we do a lot of community work, engaging with the community, working with the people. Also, we work with young people to keep them out of trouble, to teach them about different aspects of policing. It's all a great thing to be part of all round. So we just let them know about what we do as cadets, what's happening in the cadets. If there's something people are interested in, then we let them know that the email address they can contact might help them fill out the recruitment form if they need support with that. We help young people in every way that we can by supporting them with up until the application, all the way through their journey as cadets, and even when they leave cadets, if they need references or to put it on their CV, we'd help them with that as well.
My name is Kat and we are here from Fablab, Coventry University. We are open to community makerspace. We offer all sorts of workshops, technical training courses, arts and crafts. Everyone is welcome in our space. We are here to bring community together, especially people who are underprivileged and not in full-time education. So my role is a mentor, and I'm here to support individuals through the journey into employment or education. So we have digital and technical courses. We have woodwork, we have digital fabrication, 3D printing, 2D modeling, 3D modeling. Everyone who's interested in IT courses is welcome. But also we have fabric upcycling. So all sorts of different projects, manual or technical, including arts and crafts, sewing, and upcycling textiles as well.
So I'm from Coventry Citizens Advice. We've been in the city about 82 years now. We were set up in the Blitz to help sort out issues obviously with that. We've been dealing with, strangely, the same kind of issues for the last 82 years. So we look at free, independent, impartial and confidential advice on issues around debts and benefits and housing, employment, and there's a whole range of other things we do. We try and reach the residents of Coventry in a multi-channel way, so we're available through a phone service first, and then there is also email, letter. In exceptional circumstances we have an in-person service, that's kind of pandemic related. We try and give as many options to people as we possibly can as to how they can get in touch with us. And one of the very first questions we ask them when they do get in touch with us is, how do you want us to continue the conversation? So even if you get to us through the phone service, if your preference is for, say, an email conversation, we'll take that message up and talk to you via email. So we talk about information, we talk about advice, and we talk about advocacy. So in all those issue areas, we will provide advice and information all the way up to legal, up to court representation. We don't do court representation. We would ask partners to take those issues up, or provide you with information about lawyers, local lawyers and solicitors, who to take that up for you. But all the way up to that point, whether it's around your eligibility for anything, your entitlements, what your rights are, challenging decisions, information about codes of behaviour, information about where to find more information, all those kind of things. We have trained expert advisors, either paid or volunteers, to give you the best service we can give you.
So my name's Heather Davidson and I'm from the Peace Orchard in Coventry, and we provide support and help to anyone who's interested in wildlife and walking in a beautiful space. So that's why I'm here, to offer those services. I think we all know that the outdoors and the green environment has a beneficial impact on health and well-being, but the added bonus of the orchard is that it's actually been designed to be a bit of a sanctuary, and it's got lots of messages of peace there, and we do lots of arts and environmental activities that enhances the place but also improves your own health and well-being. The orchard's up at Cowden Hall Park on the Tamworth Road. There's a big car park there. We've got a beautiful mural on the changing rooms to see. First of all, then there's a accessible path and trail down to the orchard and the woods that we also look after.
Hi, my name's Suman Gaiwal. I'm a Communications and Engagement Manager leading on diabetes awareness and prevention for NHS Coventry and Warwickshire Clinical Commissioning Group. Today I'm promoting type 2 diabetes prevention. So we've got a programme here in Coventry which is the National Diabetes Prevention Programme. It's a 9-month course where people can either self-refer in, or you can just go online at www.nhs.uk and look for the Diabetes Prevention Programme, or you can go to your GP and speak to either the GP or the practice nurse. It may be that you're recently been told that you're at risk of developing type 2 diabetes. The Diabetes Prevention Programme will help you along the way to manage your food, increase your physical activity, look at how you can generally look after yourself and try and avoid developing type 2 diabetes. So normally people, when they're diagnosed with type 2 diabetes, it's an absolute minefield of what do I eat, when do I exercise, what types of food should I be eating, and then all the medications. So sometimes that can make people feel quite overwhelmed, and it can sometimes even bring their mood a bit low. Some people sometimes go into a little bit of what we see as depression. There are services there. There's the IAP team, improving access to psychological therapy. They can help with managing the mental health side of things. But it's really, there's services out there to support people. A little bit of encouragement and giving you that confidence and empowering you to understand the types of foods that you should be eating, how much exercise to do on a daily basis, and that should hopefully help people. People can get in touch if you want to go to the Healthier You programme, which is the national programme that's being run by the NHS. You just go online and it's www.england.nhs.uk and it's NDPP. And if you look for the Coventry and Warwickshire tab, that will help you to find the local service that we've got in place here.
Okay, so my name is Anna and I work for Cadets Trust Heart of England. We're a charity that supports carers in Coventry and Warwickshire. So we can do carers assessments with carers on behalf of the Coventry City Council. And a carers assessment is just a conversation about people's caring role, if there's anything that they're struggling with and how we can best support from there. We do a lot of signposting, we run our own activities and support groups as well. And we have the CRESS service, which is a carer emergency response service. So if anything happens to the carer, they're not able to look after their cared for. Let's say they have to go to the hospital for a couple of days and there's no one else to look after the person that they care for, then the CRESS service will be able to come into their house and support that person for up to 72 hours, and that service is free as well. So obviously, because it's an emergency service, they can there's someone always covering the emergency phone number for that, so they can just call us anytime they need our help. So my role is to support working carers specifically, and there are so many people who don't even realize that they are carers because they think that, oh, I'm just helping my mom out with her shopping once a week, but that is being a carer. That's exactly what it is. You don't have to do it full time. You can just support for like even 1 hour a week. That's already being a carer, and you are able to access our support with that as well. So to get in touch with us, you can go on our website, Carers Trust heartofengland.org.uk, and there's our phone number on there, and there's also an online form that people can fill in, and then we will get back to them.
Hi, I work for Grapevine, and we help people who are suffering from poverty, isolation or disadvantage in Coventry and Warwickshire. And the project I work on is Help and Connect, which is working with people in Coventry, this project, who have a learning disability and or autism, and we help them to build networks in the community that help them to thrive. So that would be starting with, the person, like what are their personal dreams and desires and hopes for the future, and then we think about places and people that we can connect them with in the community so that they have a strong network of people looking out for them and that they can look out for those people. One part of that is we have the health team as well, and the health team, they work training medical professionals, so that would be sort of experts by experience. So that would be people with autism would go and train medical experts about how to work with people with autism. People with a learning disability would go and train somebody about how best to work with them. And then we also have Safe Side as part of this project, and that works with groups of people and also in one-to-one as well, where they have some issues around safety and they want to be able to access life fully. Maybe they want to do internet dating, or maybe they want to travel somewhere, but there are some barriers in the way, and that team, Safe Side, will help you to get those barriers down through training and through sort of group work. So.
I am a connectee with Grapevine. Emily is my connector, so she's been helping me kind of get out into the community and do some work with the project that I'd like to basically get off the ground, and it's really engaging with the community. I've had really good fun at the moment going to the different projects that there are in Coventry, and there's a lot of them out there. So Grapevine has really helped me get out of kind of a bit of a rut that I was in, like mental health wise, the kind of social prescribing level side of things. It's really good. So I've been working with Emily, and it's been really enjoyable, and basically the project that I would like to get off the ground is something that I'm going to present at through Grapevine, but it's the collaboration station, and that's something that I've been really enjoying so far.
Oh, you can self-refer, so you can just turn up at our door and knock on and say, "Hi, Grapevine, we want to come in. We want to be part of what you're delivering." And our office is on Spon End, or you can be referred also through anybody that knows about you. So you know what, your family could do a referral, a professional could do a referral. So there's lots of ways in. It's a very easy system for coming and getting involved and growing your network. So it's open to people. Yeah.
I'm Minnie, and I'm from Healthy Lifestyle Coventry, and our service is delivered by Ice Creates. So basically what we do is we provide services for stopping smoking, healthy weight management, healthy diet, being more active, and alcohol management. So I'm from the Stop Smoking team, and what we do is we provide a 12-week program, and within that program we support you with NRTs and behavior support. We prescribe NRTs, and you can take this along with our support from our coaches, and we help you and guide you to get through the 12-week quit. So it's just little things, basically, like your lifestyle, which type of a smoker are you, those things that we make you help realize and support you through the quit. So we have our self-referral process as well. So we have a telephone number. You can contact us at any time. It's Healthy Lifestyle Coventry. We have our website as well. Once you self-refer yourself, you'll be in contact with a coach within a week, and you can start your journey then.
So my name's Ed, I'm the sales manager for CV Life and CV Lifestyles. We're here to promote lifestyles in terms of kind of the gym, the leisure facilities that we do offer, as well as different programs for wellbeing programs. So cardiac rehab, cancer rehab, COVID rehab is a very big one at the moment. So we do run those kind of wellbeing programs for the general public as well as corporate. As you can see behind me, there is a test going on at the moment where the young chap is looking at his kind of body composition, so muscle mass, fat mass, so people can kind of see where they are fitness-wise. So we can say, whether they need to do more, whether it be it weight loss training or muscle mass training, or whether they're dehydrated, whether they have bone density or anything like that, any issues there. If you feel at all you're interested in any kind of fitness, be it swimming, gym, group exercise, if you want motivation to train with a group X trainer or anything like that, it's literally the first step is either phoning up or walking in. And the guys will be able to help you out, set you up on a membership, and get you started straight away. So we've got the programs. If it's really serious kind of rehabilitation, we can have you with that. If it's solely a case of you've moved to the area and you're looking to change gyms, we've got that as well. So yeah, that's why obviously we're here with all the leaflets and everything, trying to promote healthy lifestyles basically.
Hi, I'm Pam Sidhu and I work for Health Exchange, and we're a social prescribing organisation, and we support people in North Warwickshire and Rugby and Coventry. We work with people in the community, and we also have PCN link workers in the GP surgeries. Anybody could be referred, either they could be referred through their GP or self-refer in the community. And what we do is we look at a holistic assessment for the individual patient or client, and we look at what their needs are. So it could be housing, could be mental health, could be physical, benefits, anything. It could be isolation, and we work with that individual to empower them and support them with that individual need. And what we do, we work with organisations that are here today in joint working to offer the right and correct support for that individual. We work with their journey up to 3 months, and if their health and well-being is improved, that's great. We will discharge them, or we will work with them longer to get a positive outcome for them. So yeah, that's what social prescribing is to look at what is needed for that person, and then work with other organisations and refer them to the right person.
I'm here today with Playlists for Life, and my name's Carrie Backhouse. So I'm the local organiser for the charity, and Playlists for Life is a dementia and music charity promoting the use of music, personalised playlists for people living with dementia. So you might know about that flashback feeling that you get when you hear a song from your past, when you hear a song that connects with you from your childhood, from when you were a teenager. That can take you right back to the time and place, what you were wearing, who you were with. Well, that works for us, and when we listen to those songs, it lifts our mood and encourages us. But for someone with dementia, it is a lifeline. It can really support their well-being. And as they progress with dementia, we encourage everyone to have a personalised playlist. So we can do that now. So we've been encouraging everyone here today to do that so that they can make their own playlists. And I'm here today to support organisations to set up help points across the cities so that they can get our lovely, amazing information out. So we've got these gorgeous booklets, Create the Soundtrack of Your Life booklets that take you through different eras in your life. And we've also got all these leaflets and conversation starters, and these are fantastic prompts to get people to start to make their personalised playlist. So you don't need a referral to make a playlist, but we are working with social prescribers today to get them to signpost to the charity, but also to signpost to the different hubs around the city where they can get more information, they can get the kit that they need. So the charity's aim is to set up help points that are active in the community and spread the word about music for dementia.
I'm Elisabetta. I'm an employment specialist for Thriving to Work. Thriving to Work is a program that runs within Coventry and Warwickshire areas. We support people who have health difficulties, any health or issue, back into employment. Our criteria are that they need to be over 18 and wanting to work. We work on an IPS module. IPS is an individual placement and support, and it's mainly to support people who have any health condition back into employment by working with clinicians and as well with employers. So putting reasonable adjustment into place so that once individuals get back into work, they can retain the job. So they can self-refer. They can send us an email to our email inbox. They can contact us by phone as well, or use the website as well to contact us. We contact them within 48 hours, so it's a really quick service.